By now, you have heard that there has not been enough research about lifestyle and cancer survival yet to make specific recommendations for cancer survivors, which is due to some specific challenges when doing this type of research. You have also heard that there is currently a lot of interest in this research area and that many studies are starting now. Cancer survivors are looking for ways to improve their chances of cancer survival. They are often highly motivated to change their diet and lifestyle in order to do so. For example, many patients struggle to maintain their weight, but they often receive conflicting advice and are unsure of what to do. Unfortunately, there are no specific guidelines for them to follow yet. This is because there is not enough research done on cancer survival. At the moment, some evidence already exists, but the combined results of many more scientific studies must provide clarity and should form the basis for recommendations on diet and lifestyle in cancer survivors. So, what do we know? A healthy diet, a healthy weight, and regular exercise are important to prevent the development of cancer. The combined results of over 10,000 studies have shown that this is true. But what is the role of these lifestyle factors after the development of cancer? So far, researchers have studied this relation most often in patients with breast, colorectal, and prostate cancer. That is because these are the types of cancer that occur the most, and because of these types of cancer have the best survival rates. It is therefore more relevant and also easier to study these specific cancer groups. In breast cancer patients, for example, there is limited evidence that lifestyle factors such as body fatness and physical activity are related to survival. A greater body fatness increases the risk of overall mortality, and more physical activity has been shown to decrease overall mortality in breast cancer patients. But this was only studied in survivors at diagnosis and survivors after treatment. There is not enough evidence that changing someone's body fatness or their physical activity will also change their chances of survival. In addition, there is no strong evidence that eating a specific diet increases or decreases the chances of survival, and which mechanism in the body are involved in this. Currently, there are many gaps and inconsistencies in the scientific literature. This also means that we do not have enough information yet to make recommendations for cancer survivors. However, guidelines do exist for the general population to decrease their risk of developing cancer. It is unlikely that these recommendations are harmful for cancer survivors who have completed their treatment. Therefore, if they can, cancer survivors who have finished their treatment are encouraged to follow the general advice from the World Cancer Research Fund for cancer prevention, to be a healthy weight, to be physically active, and to consume a healthy diet. The official recommendation of World Cancer Research Fund for cancer survivors is after a cancer diagnosis, follow our cancer prevention recommendations if you can. But obviously, each person with cancer has their own specific circumstances. Therefore, they should always check with their health professional what is right to do in their situation before they make any drastic lifestyle changes. In the meantime, more studies on lifestyle and cancer survival need to be performed to reach a similar number of 10,000 studies that we saw before on the development of cancer. Only then we will have enough results to summarize and we will have adequate evidence to justify specific recommendations for cancer survivors. Thank you.